Hello, and welcome to our presentation on one of the most infamous examples of unethical medical research in American history, the Tuskegee Syphilis study. This experiment ran for 40 years and forever changed how we approach ethics in human research. Today, we'll take a closer look at what happened, the ethical violations involved, and how the study continues to influence healthcare and research today. The U.S. Public Health Service began the Tuskegee Syphilis study in 1932, targeting 600 African American men. The stated goal was to study the natural history of untreated syphilis. However, the men were not told they had syphilis and were not treated, even after penicillin became the
Based on the three basic research principles of respect, beneficence, and justice, this study was unethical in many different ways. Respect was violated as there is no record of informed consent for the study, and participants were not made aware of the study name, its purpose, or potential consequences. Beneficence was violated as effective treatment was withheld once it became available, and the results of the study were meager compared to the harm that was done to the participants and their families. Finally, justice was violated as this study demonstrates the racial injustice of healthcare, focusing this particular case on African American men.
Some of the consequences of this study included untreated illness and suffering and death. Hundreds of black men were deliberately left untreated for syphilis, even after a cure became widely available in the 1940s. Many participants also died from syphilis or complications, and some even passed the disease to their partners and children. This fallout led to a national outrage and legal action. In response to the scandal, a $10 million settlement was paid to the survivors and their families. In 1997, President Bill Clinton issued a formal apology on behalf of the U.S. government, acknowledging the severe breach of trust.
The National Research Act was passed in response to unethical studies like Tuskegee, creating federal protections for human research subjects. The act led to the creation of institutional review boards to ensure research involving humans meets ethical standards and protects participants. The Belmont Report, which was established in 1979, established three ethical principles: respect for persons, beneficence, and justice to guide human subjects research. The Tuskegee study caused a deep erosion of trust in medical systems, especially among African Americans. Historical research abuses have contributed to ongoing health disparities and medical hesitancy in marginalized communities. The ethical guidelines of the Belmont Report remain crucial in promoting fairness and protection in modern public health research.
The Tuskegee Syphilis study taught us that informed consent is critical. People must know what they're signing up for and agree voluntarily without being misled. It also showed the need to protect vulnerable populations. Groups with less power or education are more at risk for being exploited in research, so extra safeguards are now required. We learned the importance of transparency and accountability. Researchers must be honest and take responsibility for their actions to prevent harm and rebuild public trust.